Welcome everybody to the big idea, where what we do is we have a look at a little bit of research that talks about some pretty heavy, pretty in-depth thing, but then try to break it down into plain English so that two groups of people can understand it. Number one, healthcare practitioners who kind of need to know this information, but arguably and even more important, people who experience these kinds of things so they understand what's going on in their body so that they know what different options that they have. And today what we're going to be talking about is going to be the topic of spinal cord stretching and how different entities of the spine can impact nerve function. So as we're going to be getting the ball rolling here, we're going to get into it pretty much straight away. But as always, if this is a topic of interest, then we would invite you, like you please, to click that like and subscribe button down at the bottom there. Why would you do that? Well, it helps us out. Cool. Appreciated. But arguably more important, it helps the internet algorithms recognize this video so that people who need to find this information are able to find it. And so what we're going to be talking about here is focal cervical spinal stenosis causes mechanical strain on the entire cervical spinal cord tissue. A prospective controlled matched pair analysis based on phase MRI or phase contrast MRI back from 2021. 2021. 2021. So it's a bit of a mouthful, that title in and of itself there. We're going to try and explain what that means. And in its simplicity, in its generalities, is actually quite a very simple, also very important concept. So the good news, not too very much for me to read from the summary. Nevertheless, here we go. Focally increased spinal cord motion at the level of cervical spinal stenosis has been revealed by phase contrast MRI, which is going to be known in this article as a PC MRI. This implied an upbuilding stretch on spinal cord tissue, cranial and mechanical compression caudal of the stenotic level. Furthermore, significant far-range effects across the entire cervical spinal cord were observed. Okay, cute. Arguably, you could say you got, more information probably out of the title. What does this actually mean? Let's give you a few basic terminology things and just a bit of appreciation first in terms of what we're talking about. Spinal cord and spinal cord motion. I oftentimes will use the idea of a balloon with a piece of string attached to it. The balloon is your brain. The string, like this, is your spinal cord. And so the balloon is supposed to be sitting inside of your skull. The spinal cord is by and large hanging as it goes from the upper part of your neck all the way down to your sacrum, that is your tailbone. And what you can have along that course as it's, anchored and held in place at a few different levels or tethered like a series of tension cables, what you can have is you can have different kinds of disruptions that essentially that normal opening where that cord lives can become narrower. And the fancy term for that is called stenosis. So when you hear the term spinal canal stenosis, this is referring to a narrowing of the opening where your spinal cord lives. And that can be a problem. Not always, but that can be a problem. Well, why is that? Well, it's because if your cord normally is supposed to have a certain amount of space in and around it, as it starts to encroach like this, it can increase the hydrostatic pressure. It's not exactly the same, but imagine if you would that you took your finger and you wrapped a rubber band around it like this. Well, that's going to congest the normal flow of fluid around that, and it's going to start to get a little red and then a little blue and then a little purple, and if you do it long enough, it'll fall off. Don't do that. But you can understand that you can feel this building up of pressure. Similarly, when you have stenosis, it can be disrupting the normal flow of the fluid inside of your cervical canal. Well, not just the cervical as in the neck, but really anywhere in the spinal column. And that in turn can start to disrupt some of the normal transmission, the functions of the nerves, and leading to a variety of different issues. And this is a term that some of you may be familiar with, and they don't really talk about it in this particular article, but a really useful one. Myelopathy. A myelopathy, myelin or myelo, refers to some kind of a nerve. Pathy means pathology, something is wrong with it. And so in particular, a myelopathy is reference to something is wrong and it's affecting the spinal cord itself. And the cord, your cord, being that major transmission of the different life functions, the different sensations that come and go to all different parts of your body. If you've got an issue with the spinal cord itself, well, you can have any number of different issues, whether it's affecting the brain, whether it's affecting your hands, whether it's affecting your feet. One of the most severe but also common examples that people are familiar with is the idea of a myelopathy would be a fracture of the neck, breaking the neck, and as a result, compressing or impinging on the cord to the point where it causes paralysis. So not a very pleasant kind of condition, but you can appreciate, okay, yeah, that makes sense. As if you disrupt cord function, you disrupt life function. Now, we're maybe not talking about those particular kinds of injuries to that same degree, but I want you to imagine those kinds of conditions then that can produce that stenosis, which can then narrow, put more pressure, create even tension, interfering with that normal cord function. So instead of 100% of those messages being able to transmit clearly, freely, without a problem, imagine that it was reduced down to 90% or 80%. Or let's say that you still have the same volume flow of information, but you start throwing in little bits of corrupted messages, where suddenly your brain is not receiving an accurate portrayal of what's going on in the periphery. And so you can start to experience chronic pain syndromes, such as tingling in the fingers, tingling in the feet, crippling low back pain, crippling neck pain. It can be associated with a number of different kinds of things like that. So that is what a myelopathy is. Now, as far as causes of stenosis, the most common one is going to be degenerative arthritis, or what we know as disc damage. So in between the vertebra from C2 all the way down to the base of your tailbone, there are these little cushions, which are called intervertebral discs. And they're not actually cushions per se, because a cushion implies that these things are soft and spongy. Discs are not. They're basically built like the tire on your car. They are thick, they are firm, but in the same breath, they have just a little bit of give. And the purpose of them is to provide a little bit of that shock absorption and cushioning effect so that you're not going to be rubbing bone on bone. And these are going to be what are providing a huge amount of the stability for your spine so that all of the units don't just fall apart at the first time that you lean forwards or backwards. Now, the caveat here is that discs can, like tires on your car, start to erode or wear down over a period of time. And oftentimes people say, oh, that's just normal aging. Well, I've got to disagree with that. And it's because, well, every day in my practice, I see people who have damage in one disc in one area of their neck, for example, but the areas above it are just fine. Okay, so if we were using that logic that it was aging, is that area where you have that degeneration somehow older than the one that didn't? Or if a person needs, for example, say a hip operation. Oh, yeah, I need that hip operation because that hip is worn out and it's because I'm older. Okay, well, is that damaged hip that needs the surgery older than the one that's still doing just fine? Well, no. So age in and of itself isn't the issue here. What usually is the issue is it's the consequence of an old injury where you didn't necessarily break, didn't dislocate, and maybe you had it checked by the paramedics or the emergency room department, and they said, nope, nothing's broken, nothing's dislocated, go home, you're fine. You'll get over it in a few days. But imagine that what it does is it produces a little shift in the center of gravity, and then you've got joints of your spine that are not moving the way that they are supposed to be over a long period of time. Imagine, if you would, that you're supposed to drive up the highway in your car. You need to get up to 100 k's an hour, but you're only allowed to do it in second gear. Can you do it? Well, the short answer is yes, but it's probably not going to be very good for your transmission. Now, your transmission may not blow up right away, but those things are going to grind to a point where eventually it starts to give. And when it comes to discs, when discs have abnormal stress and strain that accumulates over months, years, usually decades, it eventually gets to the point where what they start to do is they start to bulge into that area around the spinal canal. And then what they do is they become a focal source of pressure or irritation that makes that opening narrower. Ergo, we have the condition that is known as a spinal canal stenosis, secondary to disc bulging. A lot of times when people use that expression, oh, I've got, these issues because I slipped a disc. I repeat, you basically have to be hit by a truck to damage a disc that hard all at once. This is usually a process that occurs over quite a long period of time. And it's important to understand. And then when it comes to trying to find resolutions for these things, it's usually not something where you just snap of the fingers and boom, you can immediately undo 20 years worth of damage. It can be done, but it's going to take a little bit of time and it's going to take a little bit of work. Now, something that's also worth probably pointing out at this point is just because a person may have a bulging disc, whether it's in their neck or it's in their back, it doesn't mean that you necessarily have to have pain. Same thing goes with arthritis. These are risk factors. So about 85% of people have bulging discs in their lower back, but not everybody has sciatica. And about 15% of people have bulging discs in their neck, but not everybody gets pain, numbness, and weakness down into their hands or their fingers. So we need to understand that these things are risk factors that mean that there's an increased probability that you will experience pain, dysfunctions, and other problems, such as those myelopathies that we talked about down the track. So now that we've taken just a little bit of time here to kind of summarize and give you the explanation here that when we're talking about stenosis, particularly as it relates to the neck, that this usually is not something that came on overnight, even if your symptoms did. It was a process that was in the making over a long period of time. This then is the end product. And this research here tells us a little bit more about how a local problem can actually have more widespread effects. So let's have a little chat and have a little look at this one here now that we've laid the basics. Within the field of degenerative cervical myelopathy, see, degenerative, arthritis, wore down, myelopathy, there's that word, altered dynamics effects within the spinal canal revealed by a phase contrast MRI are currently gaining interest as a possible new diagnostic parameter. PCMRI allows a non-invasive, quantitative evaluation of motion without application of contrast agents. This is pretty darn cool. And it's because standard MRIs, as useful as they are, think of it that they would be like a TV where it is like a 720p contrast. If you are to inject dye into a person, so gadolinium as an example, it upgrades it to like a 1080p, so a high def. The problem is that can cause a lot of different metabolic issues, and some people have adverse reactions. It's not a very good way to go. And so a PC MRI, phase contrast MRI, what it is, it's a relatively new technology, and think of it as the equivalent of 4K resolution, super high def resolution, where what it lets you do is it lets you see all of these extra details. And what it also lets you do is it lets you take a number of different slices over a period so that you can actually get the perception of motion. You see, whether it's an X-ray, a CT scan, or an MRI, these are all wonderful tools because they give you a snapshot of things at that particular moment in time. But in reality, the things inside of the body, not just your heart, not just your lungs, and not just your digestive system, but your brain and your spinal cord themselves actually move on the inside of you. You usually can't feel it unless you're really calm and you pay attention. You may feel your body making this subtle little forwards and backwards sway like that. That's what's known as the cranial sacral rhythm. And what a PCMRI, as one example, illustrates is that your brain actually pulsates and it moves like this. Kind of neat. And what you actually see is you see that the spinal cord actually moves up and down like this a little bit within that neural canal. Also pretty neat. So this seems to be part of the normal rhythm in which your nerve system, your brain, your spinal cord, that balloon and that string needs to be able to move in order to operate and function correctly. So this technology lets you have a look at some of that stuff. Pretty darn cool. And what they do now is they talk about saying, okay, we have some interesting things that we want to have a look at, and particularly as it relates to how you may have damage in and they were looking here in the middle part of your neck, how that might affect some of those different cord dynamics. And they get into some of the technicalities about all of this and all of that with the, technology and the wonders and all that. We're not going to bore you with that. We're talking about the big idea here, not the detailed idea. So what we've got here are a couple little pictures here, and when it comes to the diameter of the spinal cord, for the sake of these pictures, all I need you to think is it like a channel like this. And you can go all the way back to Sesame Street, where what you're looking for is there a disruption, a narrowing of the channel? That's what these guys are looking at. That's what is called the stenosis. And so what we have here highlighted in the green, that's going to be your spinal cord sitting within that canal. The blue area then, this is the fluid, that cerebral spinal fluid I described, that bathes and envelops your cord like that. And so where you see this stenosis, oh, there's not that fluid there. That is because something is narrowing that opening. And guess which way your body is going to say, well, which is more important, that we're going to have reduced fluid, or we're going to have something immediately start crushing and compressing our cord? The cord is kind of a little bit more important. And so what you see is you see localized areas where you don't have the normal fluid flow dynamics. Again, not too dissimilar from this. And you can test it and look at it any number of different ways. And in particular, even though you may not be able to appreciate it and see it here, each of these little gray things that you're seeing, these are corresponding with the vertebral bodies. And these black stuffs that you're seeing between them, those are the discs. And you might notice that this particular disc between C2, C3, C4, between C5 and C6, located right here, that is what is responsible for bulging in, narrowing, producing that stenosis, narrowing that canal diameter. That's what in this particular case is causing that localized effect. So they can say, cool, we can use this technology to identify these kinds of things. And you can see evidence of this stuff if you're looking at just a standard X-ray, a standard CT, a standard MRI, but they're showing it now, so it's not just how the ligaments and how the vertebral bodies are impacting things. They can also show the consequence of that are these altered fluid dynamics. And there's a lot of research, a lot of research that discusses and talks about that. But that's a topic for another time. I want to get into the really important stuff right here, because again, this particular article is a little bit hard to read. I won't lie about that. But it's the pictures. It's the pictures here that illustrate this perhaps the very best. And it would be nice if I could perhaps take this picture and turn it like that. I'm not quite that computer savvy, or more appropriately, I am, but I don't want to disrupt it for the sake of this video. So in brief, we're going to be imagining that the person here is actually lying down. So when you're looking at the length of their spinal cord in the neck, it's not oriented this way, it's oriented sideways like this. So firstly, what they're documenting and what they're showing here is when they're testing normal subjects first, that cord moves like this, a grand total of about 10 millimeters over its entire length. And on an average, we will say that the average person's neck is going to be approximately 10 centimeters long. So it actually moves up and down about 1/10 of its total length as a general rule of thumb. Pretty cool. Now what they wanted to see was that if you have something like these stenotic lesions, something producing narrowing, how does that change how that normal cord moves? And this is what they found. They found that cord does still actually move. But at the site right where that cord is supposed to move, it's not going to be moving as much. But in the adjacent areas, particularly, at least in the case of a C5 disc lesion right in the middle of the neck, it causes the area immediately above to be stretched. In other words, the cord is still moving, but the site right at the lesion is not moving as much, and the spot above it is starting to be stretched more than it should be. And this is super duper important, and it has to do with the nature of how nerves are able to function and fire. It's a concept that in certain circles, particularly in chiropractic, is known as tone. The idea, and you can appreciate this especially if you were a guitar player or somebody who played any kind of stringed instrument, any pitch, ding, something like that, ding, is going to be based on the relative amount of tension. It's going to produce a vibration. And the vibration, particularly as it relates to nerve function, is ultimately the way that that information is going to be transmitted. But I want you to imagine then now that what you have is you have information that's traveling, and we're going to just use this as an example. It's traveling, say, from your hand, and it goes from your hand up your arm. It goes into the base of your neck, into your spinal canal, and it starts going up, but then it hits that point where that stretch happens, up, and it changes the pitch. It changes the nature of that information that's going up to the brain. It's producing what's called mechanical deformation. And when and where you have mechanical deformation, it starts to affect the quality and the quantity of the information that's being transmitted up to the brain. That is what the significance of stretching a nerve is going to be. Disrupted function. And here's the other interesting part. Not just do you have that disrupted function then at the level where the lesion was, but what they found is that it actually will transfer at least 3 vertebral levels up. That's what they're having a look at right here. They're looking to see how much additional stretch is occurring at the adjacent levels. And the standard, if you're looking, and again, I'm not expecting you to look at all of these, details here, but they were finding, on the average, if you kind of look at, that's not going to work. These ranges here, you're going to see that the mean is that it's going to have a total displacement of about 1 millimeter. But when you had that disc lesion, suddenly what you have is you have at least a 1.5, but upwards of double the total amount of stretch occurring at not just that area, but on the areas in particular immediately above. What does that mean in terms of tangible stuff? It means that if you have a disc bulge, say at just the level of C5, that's not the only spot that's going to be affected. It's also going to affect a couple layers below, and it's also going to affect a few layers up, going all the way up to at least C2. This then is going to be very important for something that I'm going to talk about that these guys didn't actually talk about in this particular research study. Why? Because they weren't looking at it. But we can use their findings to extrapolate and then discuss a few other ideas, not necessarily draw any grand conclusions, but to put forth the hypothesis about what is possible and how these kinds of issues can create far-reaching consequences elsewhere in the body. So, what do they say in their own words? This implies an upbuilding stretch of the spinal cord tissue, cranial of the stenosis, which means above it, followed by compression caudal of the stenosis. The spinal cord tissue is object of an upbuilding mechanical stretch, cranial of the stenosis, above it, and compressive effects caudal or below the site of stenosis. The focus of these effects remains at the segment adjacent to the stenosis, but still far-range alterations of spinal cord motion, and we're saying that as a result function, up to 4 segments apart can be observed among patients. Furthermore, data of healthy control assessed a physiological evolution of spinal cord motion across the cervical spine, relations to spinal canal, cross-sectional, cross-sectional something. I'll have to come back to that, sorry. An angle of the cervical lordosis in supine positioning. Within patients, these observed relations dissolve, implicating relevant pathodynamic alterations within the spinal canal. So what this means is it means that you're going to have these, again, localized lesions, but there's actually going to be far-reaching effects going on, and it's not just subject to the way that a person is lying down when they are actually having the particular MRI. So what is the take-home message in terms of what we're saying here? We're saying that when you've got a localized issue in the spinal canal producing that stenosis, it doesn't necessarily produce local effects only. Now, let's build on this a little bit with some discussions of things that are not in this particular paper, but I think are worthwhile noting. You don't just have discs that are potentially responsible for producing a spinal canal stenosis. You can also have what are known as dentate ligaments. These are little ligaments that anchor the inside of each of the vertebrae going all the way down from the very top of your neck at C1 all the way down to L5, and they act as tension cables. Now, in the lower part of your neck, these ligaments are loose, like a piece of string. And guess what? They are loose so that they can allow a grand total of, guess it, 10 millimeters worth of total up and down movement. Beyond 10 millimeters is when and where you start to have the potential to cause deleterious effects. That is where the ligament starts to exert tension on the cord, which produces that mechanical stress and strain, which is going to be associated with the same kinds of issues we talked about here. Now that's the lower neck. They didn't talk about in this article the upper neck. The dentate ligaments in the upper neck, these things are not loose pieces of string. These are broad, thick, and strong. They only allow a grand total of 3 millimeters worth of total movement like this. In other words, the amount of give that you have in the lower neck is a lot bigger than it is in the upper neck. In the upper neck, you do not have too terribly much give at all. Now, why is that important? It's important because, going back to the idea of physical injury, if you have an injury that affects your upper neck, it's more likely that it's going to be producing issues. We also alluded to this earlier, but I'm going to hit on it again, that you have intervertebral discs from C2 all the way down to L5S1 in your spine. There is no disc at the very base of your skull or at the next vertebra below, the ones above and below what is known as your atlas or your C1 vertebra. The reason for that is because this vertebra is designed to move. It lets you do this. 50% of all of your head neck movement occurs at those sequence of joints right up at the very top. So there's no disc that provides stability. This area is held in place and checked by these muscles and ligaments. But what it also means then is that this particular area is more susceptible to physical injury. And again, not necessarily broken, dislocated, but if that vertebra then, say, gets shifted and locks outside of its normal range of motion and gets stuck there over a protracted period of time, that can, via those dentate ligaments, exert that same kind of mechanical pressure. And if you were to just do a basic movement, say something like this, that vertebra is normally designed to move to the better part of around, maybe not all the way, but we'll say at least, half of a millimeter in any one direction. And so in and of itself, yes, what this does is that actually produces some movement, stress, and strain on your spinal cord. That's not a problem. But could you imagine then what happens if your head relative to your neck essentially gets stuck in this kind of a position? Yes, it's going to find ways of compensating like this, but if, for example, you're somebody who notices that you always wake up with a sore neck, or whenever you have a picture taken, your head is tilted, or you have one shoulder that's dropped lower than another, these are all signs that something's not right in terms of this upper area, and your body is finding ways to compensate. And why would it do that? It's because if it doesn't, the fact that that vertebra could be shifted from its normal range of motion means that it is actually exerting pressure on the cord via these ligaments. Now, why also does this matter? Okay, some research going back into the 70s and the 80s, they found, and they were looking at peripheral nerves, slightly different but same principles, that if you wanted to decrease the ability of a nerve to fire, all you had to do is you had to put the equivalent of 10 millimeters worth of pressure. So again, not unlike this, basically about what you would use if you were trying to squeeze or pick up a 5-cent coin here in Australia, that would decrease the function transmission of a nerve by about 60% in just 15 minutes. And when you're talking about the potential of vertebral misalignments, at least as it relates to the upper part of the neck, in order to produce that same amount of dysfunction, all that you actually need is half of 1 millimeter to actually produce that same amount of tension. Whoa, Jeff, are you saying that every single time that you're, moving your head into your neck, you're choking off life to your brainstem? No, that is not what's actually happening, because in that moment, your body's able to compensate. That's normal. But if, and this is what I am saying, or at least what I'm proposing as a hypothesis, is that if you have that vertebra where it's shifted just that little bit, And instead of it being able to have that bit of pressure, but then restore, come back to normal, that you have the slow accumulation of pressure over a long period of time, like unpaid compound interest that adds up over months, years, or decades, producing a range of issues right up through here. And what did we say about cord stretch then? Is where you would have a local site of stenosis. And if you're dealing with a misalignment in that top vertebra of the neck, that is exactly what it produces. You have a stretching of the cord, and in this case, the brainstem of the area right above it. And what is that responsible for? Pretty much everything. It's called your medulla. It sits pretty much right above where my finger would be, about 1 centimeter, which is more than enough for it to be in the direct firing line here. This is what is responsible for all of your vital life functions and the transmission and the master control center for all of the information that's going down from your brain to the rest of your body, and all of it going up to the top. Again, I'm not trying to be, terribly morbid or anything like that, but if I had to say, you're going to have a back fracture, a spinal fracture, where would you rather for it to be? Would you rather it to be down at your L5 or up at your C1 at the very top? You're going to say, okay, if I had to choose L5, because we understand and appreciate that the higher up that the problem is and the closer to the brain, the more likely it's going to produce systemic kinds of effects that we cannot always predict or control. This then is the importance of what we're proposing here and what is supported with this particular research study right here. The appreciation and the understanding then that you can have an MRI and it will show you where you have different sites of lesions and problems, but how it's possible that that focal issue can actually have far-reaching consequences and effects. And this is also very common for people who may be experiencing cranial kinds of issues with their balance, issues with facial pain, issues with chronic fatigue or full body pain, or different kinds of things along the line like that, where, okay, we would normally think this is associated with brain function, but you have the brain MRI and the brain set MRI says everything is okay. Well, is it possible that there's no pathology of the brain, but there's something that's producing a little bit of stretch or irritation, and it just so happens to be 1 to 2 finger widths just below where the area is actually being looked at? In other words, we're putting forth the idea that the upper part of your neck could be responsible for a huge amount of these kinds of issues that are otherwise not going diagnosed. And if that's the case, it means, especially if you're experiencing all of these issues, do not ever forget to assess the normal motion, alignment, function of that upper part of your neck, because it has such a profound impact, not just on things up here, but through the entire system, because of how it has the ability to produce that mechanical stress on the spinal cord and on the brainstem itself, that, as this research is showing, can actually have not just local but far-reaching kinds of effects. Whew. So, a bit of a mouthful in there, but I do hope that you managed to take away the big idea there. The idea that, yes, you can have a vertebral malposition or something else that's producing stenosis, and it's actually producing stretch of the nerves and issues elsewhere. So, hopefully you've also found not just that this video was, informative, but it was also valuable and maybe even a little bit entertaining, because I know sometimes this is heavy stuff. We try not to be as boring as possible. Nevertheless, we don't always succeed. So, if you did find value in this video then, as we're finishing up here, per the usual reminders, number 1, please do, if you haven't already done so, hit the like and subscribe button so that other people, the people who need to find this kind of information, may be able to find it on the internet. Number 2 is, if you've got friends or family who you think also need to get a load of this information that we've presented for you here today, please do share with them this video. It's not going to cost you anything, and the only thing it's going to cost them is the time it took to watch it. And then number 3 is, if you perhaps are experiencing one of the different kinds of things that I've described in this video here, and if you are, because certainly we can't service everybody in and around the world, but certainly if you are in Australia, we'd like you to get in contact with us. Our website is atlashealth.com.au. We're located in North Lakes, which is in North Brisbane. And what our focus is in helping people where they do have these upper neck and upper neck related disorders, whether it's headaches, migraines, dizziness, vertigo, tinnitus, chronic fatigue, a lot of different things, a lot of different issues associated, cervical myelopathies, tingling in the hands, even low back pains and sciaticas. Anything that's associated with stretching of the spinal cord is something that, certainly we'd be happy to have a look at and offer you any little bits of advice, recommendations, or if treatment then might be an option to see what we might be able to do to help your overall quality of life. So again, you want to check out more videos like this one here, check out our YouTube page, but if you want more blog articles on any particular condition, we write a whole bunch of them as well. Go to our website again, it's atlashealth.com.au. So thanks everybody for your time and attention watching this video. Hope you've enjoyed. So till next time, take care and bye-bye.